the number of offices doesn't matter as much. It's what's the revenue and the profitability. It's a day that we decide this has become just work and I hate every single day. That's the day we'll stop. Everything's about solutions now. 70% of treatment comes from existing patients. AI and in dentistry, it's exceptional.
I'd like to welcome to the Wealthy Dentist podcast family a doctor that's been around for a couple years. She has quite a bit to share. Dr. Anushka Gaglani. She's going to share with us her building of a just a dynamic team and where her heart lies in the process of doing all of this. She still takes time out for other people, and that's why she's here today. I'd like you all to give a warm welcome to Dr. G. How are you today?
Good. Thank you so much, Ward. I'm really excited to be here. I see your podcast sometimes and I love all the special effects and I've been waiting for this one.
Okay, great. Glad to have you here. I ask dentists uh, uh, every time, most of the time. I mean, even if you're not a dentist, I want to know what got you into the industry. What drove you here? You know,
Mhm.
the most.
Yeah. Yeah, it's actually a funny story. When I was about 14, I was reading a Reader's Digest. I used to love reading Reader's Digest, and there was an article in there about a dentist. And something kind of clicked in me. And I was like, I want to be a dentist. So from the age of 14, that's what I wanted. And, I'm lucky enough that that's how my path ended up kind of aligning. Um, but that's the long and short of it.
Mhm. Wow, you like a few others decided to do this at a very young age. You already knew what you want to do, and then you're still doing it after so long. I know when you first started doing dentistry, uh, did you come in as an associate or did you go right in and start your own practice? How did that happen?
Yeah, I started as an associate. The reality is, I think a lot of uh, in the past, a lot of dentists would come out and start their own practice right away. I'm gonna throw something controversial out there. I think training was much, much better back then.
Mm,
And I think things have changed. What I'm hearing now is dentists coming out of school are not doing as many procedures. They're doing 7 crowns instead of, 20 crowns. They're not doing any endo or maybe one endo instead of, 10 endo. So I think there's a difference there. For me, I really felt like I needed to come out and practice, learn how mostly to talk to patients and get case acceptance, because without that, there's no point in having any of the skills. And I did a couple of associateships before, Abhishek, my partner, Dr. Raj, moved here from New York, and then we opened our first practice together.
hmm And how long ago was that?
That was the end of 2015, beginning of 2016. We found a practice that was kind of, should have been sold a few years before. It was a retiring dentist. It was not doing very well. I think the revenue for the year was something around $200,000. And we kind of drove into the parking lot, saw it, fell in love with it, and said, this is the one. And no looking back since.
Wow, you knew just by driving in the parking lot that this was the one? Okay, so what was the eye candy at that particular time? What things did you say, oh, this is sweet. Let me like I'm looking here, I'm looking there. We got a Starbucks over here. I don't know how you were looking at it. So I mean, was it congested? Was it a dense area? What was going
Yeah.
on?
The honest truth is we've gotten a lot better. We did a lot more things off of feeling back in the day. As we kind of, when you start off as an amateur, you do more things based on feeling rather than on data. And that's
Okay.
kind of how we did it. There was a McDonald's down the street. It was on a busy road. It was a freestanding building. We wanted to buy the real estate. So all of those things kind of lined up.
Mhm.
Um, to be honest, there wasn't a huge patient pool. The practice needed a complete renovation.
Mm.
Uh, so, that those kind of things we didn't really look at, but we liked the parking and we liked the area.
Okay. And then when you hit the ground running, uh, how involved was your marketing at that particular point?
We had someone through marketing. We hired somebody who was kind of his a one-stop shop. Like he was a solo person doing his own marketing. He was great for the first 3 or 4 years of our business. He did a really good job. He would do Google ads. We actually did flyers back in the day. We don't do those anymore. Those I think those are kind of outdated at this point.
Right.
But back in 2016, we definitely did them.
Yeah.
Um, but a lot of really Google ads, and that's kind of what we lean into is Google and Meta since then.
Okay. And so are you still doing that kind of work with your practices? Oh, okay.
We still do that. Yeah, we've since moved on to a bigger, more robust company as far as marketing goes, because obviously we're much bigger.
Mhm.
But yeah, we still continue to do it the same way as I think most people do with the ads and the SEO.
Okay, so let me just back up a little bit and go back to when you first started. It was one office, then you went to what?
So we started with one office, and then we decided we were tired of looking at each other. So 6 months later, we bought our second office. And we decided we're like, okay, we're kind of enjoying this. We're getting pretty good at it. And more than that, we had the broker we worked with, he kept bringing us practices. And there was one, the third one, we were like, oh, this is very interesting. This is a little bit different than the original ones, the first two that we did, because this is actually a practice that has decent revenue, and the dentist will need to stay on for a few months.
Hmm.
So that was kind of our first foray into having our own associate. And that was definitely a learning experience. But, I think for us, we just enjoyed seeing practices that yeah, we enjoyed seeing practices grow, right? Businesses that had potential, but someone hadn't been able to give them the love and care that they needed, the TLC to get them to their full potential.
Okay, okay. So I'm curious as to when you did the first office and you saw, okay. So the first time it was like, okay, I had to, like, we had to separate, we got to do something in different offices. Okay, and then you did that. You did the separate after 6 months. So I'm wondering how, like, did you already have your SOPs in place? You know, what was going on?
No, no, we yeah, I know. Believe
I'm
it or not.
just gonna figure this out, you know.
And that's the funny thing. I'm actually a very process-driven person, very operational. So it's kind of funny that it was around I would say the third or fourth office that I actually started documenting things. But the reality is you'll document things at three offices, and then at five it changes, and then at seven it changes. And I know we're gonna have so many iterations of our processes.
Right.
And that's something we realized, Abhishek and I both practiced full time until office number six. We were still full time.
Oh,
And yeah, it was quite a heavy lift because we had to figure out how do we do this? How do we get everybody on the same process? How do we get our dentist diagnosing the same if we're in the chair full time? And that's when we took that effort and kind of made the moves into pulling back from practicing. And this year we had to clinically retire to be able to put our full focus on what you just mentioned is
right.
those processes and how do we get everything running the same way?
Yes, yes. Oh, wow.
Yeah.
So, yeah, and that's like a never-ending process, right?
Never ending. It will never end. I've realized that.
Yeah, yeah. Well, there's nothing wrong with trying to be perfect, trying to have perfection. Everything changes, nothing stays the same. I mean, it's like a plant, you got to water it, right?
That's exactly right. That's exactly the nice thing is once you have the majority of the processes down, then it's just tweaking them. But it's like what the processes we have now with seven practices, it's like at 50, we might have totally different things going on. So,
hmm
like you said, it's gonna keep changing. It's a work in progress.
So, how many offices do you have now?
We're at seven and an
Oh,
eighth possibly coming
oh,
on.
you're considering another yet?
Yes. Yeah.
Is there some kind of grand number you're going to say, okay, this is it?
We used to have a grand number. We actually moved away from that because one of the things we realized, when we had the grand number, we weren't really going to conferences or big in kind of the dental space. As we started going to conferences and meeting more people, we realized the number of offices doesn't matter as much. It's what's the revenue and the profitability. So we've since moved into more revenue profitability, but more importantly, as long as we're having fun and we're enjoying what we're doing, we'll continue growing. The day that we decide this has become just work and I hate every single day, that's the day we'll stop.
Okay, understood, understood. So when you're looking at a well, as a a seasoned pro now,
Mhm.
how are you looking at at your new buys now? I mean, what are you? I mean, outside of revenue, what are some of the things that you think are must have?
Yeah, for us, I think we're opportunistic. If it comes to de novos, we've kind of done all three methods. We've done the acquisition, we've done the de novo, and we've done one affiliation. I really enjoy the de novo and the acquisition because, again, I think that having basically what we look for to kind of answer your question first is location. I know everybody talks about location, but is the area growing or is it declining? Is there parking? That's a big one we learned with our second office. There was no parking, and that made it very, very difficult because people, even though we expect walk-bys, not everybody lives within a 2 block radius of the practice. Um, is it a younger population that's kind of willing to do the dentistry? Not that older populations don't, but we're looking for families because we realize that mothers are the ones that make the decisions generally in our experience about where their kids, where their husband go for dentistry. So those are kind of the things that we're looking for. And then if we're going to do an affiliation or an acquisition, we're looking at the team, right? Is the team, are they people we can work with? Are they open to growth? Everyone says that they're open to growth. Everyone says that they're open to change, but we found in our experience that that's not necessarily true, and in most cases actually isn't true. So yeah, in a nutshell, that's kind of what we look for.
Mhm. Yeah, I mean, I could be mistaken, but are you guys using EOS?
We are on EOS. Yep.
Okay, all right, yeah, yeah. I read all his books.
Yeah, yeah. No, it's great. It's been wonderful.
Yeah, great, great, great. So things are moving. How is that working for you? I mean, what are you finding? What are some of the takeaways uh, that
Yeah.
you're finding and using that particular?
Yeah, so EOS, we actually implemented it in 2020. Back when COVID had us all shut down for a couple of
Yeah,
months.
right.
the-
It's
You
time
know,
to eat,
our
right?
dentists were all scared. So it was just Abhishek and I going in for emergencies. We're going in a couple of days a week. And we started reading, Get a Grip, Attraction. And I actually really love it. I'm one of those people that I cannot stand meetings. Most meetings, I'm like, that could have been an email. I'm that person. I'm that meme. So having EOS really helped us structure in a way where we're not having people vent. It's not about venting. It's spend time identifying the solutions
Mhm.
and I'm sorry, identifying the issues and then finding the solutions. Everything's about solutions now, right? Of course, we have to identify issues because without those, we don't have anything. But we had somebody that came from a big corporate, and it was a lot. It was a lot of venting. And what I heard, what I've at least in from that experience, is that a lot of the bigger groups do have that issue, right? And I'm sure there's more complexity as you grow, but it's a lot of day-long meetings where nothing's done. So with EOS, we've been able to kind of cut to the chase and get things moving. Again, I think we have size on our side because we're still small, so we can we can right the ship pretty quickly. But I highly recommend it to anybody who is looking into having some structure. It's also how Abhishek and I work together so well. People always ask us, how do you work together as spouses? Well, we run on EOS, so we have very clearly defined roles as far as who does what.
Yeah, so who's the creative?
Yeah, yeah, exactly. Well, that's exactly it. And sometimes we'll flip-flop, right? That doesn't
All
mean
right.
that we
Oh
don't
yeah. Yeah,
both do the
that's
same. Yeah, we
good.
still
That's
we still
good.
kind of overlap, but one person's accountable.
Yeah, right. Yeah. I mean, that's why it's such a good program. That's
Yeah,
awesome. So, when you're, I mean, like, what is your day like now that you've moved out of clinical?
yeah.
What's a typical day like?
Honestly, it depends on the day. I usually Mondays and Tuesdays will go into practices. We'll do our operations L10 meetings on Tuesdays. I spent a lot of time trying to figure out process and kind of one of the things we've been doing since May, we have been focusing a lot on how do we create process and how do we create systems so that if I'm hit by a bus, the business will still run.
Mhm.
And that's again a very heavy lift.
Mhm.
That's kind of what I've been focusing on. The other part of it is, of course, we have our own little podcast that's actually coming to a wrap. We're going to be ending that soon. Um, And we started an executive MBA. That's also taking up a portion of our time at the University of Chicago booth.
Yeah, yeah.
Yeah.
Wow, wow. So yeah, it depends on what type of day. I'm
Correct.
wondering now, okay, so you have what, seven
Seven.
offices? Okay, seven. So how many, like, how many doctors, how many, team members do you have in your group?
Yeah. I think we have about 50 or
Mhm,
so team members and doctors. I'm going to say about 13, 14. I don't know off the top of my head.
mhm. So, and have you found that having more, like, more registered dental hygienists on in an office really helps with um, the bottom line, so to speak? I mean, what have you been able to find in having those different kinds of combination, or have you played with those through your?
Yeah, this is our perspective, right? I think with hygiene, a big reason dentistry is so great is people they come in for their cleanings, right? They know that twice a year you come in for your cleaning.
Mhm.
So it gives us an opportunity to see patients and ensure that we're taking care of issues before things go wrong. For that, though, I think that we need to have also for every doctor at least one hygienist per doctor because what we've realized is that doctors really need number of exams. I know a lot of doctors are focused on new patients and new patient counts. We've actually found that 70% of treatment comes from existing patients because they already trust you. They're not always doing all of their work in their first visit, so they come in regularly and then they have issues going on, so we take care of them. Um, as far as, bottom line, yes, it's definitely I really think, to be very frank, our hygiene team, we definitely can work with them better and help them become more productive. But to me, I think hygiene is a big backbone of dentistry. It's very necessary. They're not just, we tell our hygienists all the time, we don't just see you. You're not here to clean teeth. You are
Mhm.
providers. You're here to help us and help the dentist diagnose dentistry or assess and suggest at the minimum.
Yeah, I had a conversation, to your point. I had a
Yeah.
conversation with a registered dental assistant
Hmm.
not long ago,
Hmm.
and she was just saying how she might have s- three tools in one hand, two or three in the other,
Yeah.
and and she's paying attention to the doctor and seeing what he or she is doing, and
Yep.
she's paying attention to the patient and seeing if there's any anxiety, are they relaxed? You know, they have quite a bit to do as well, do you think?
Oh yeah. I hear assistants, we had an assistant and I hear this a lot. I'll hear assistants and we call them patient care ambassadors, the front desk. They'll say things like, I'm just a dental assistant. And I cut that out right away. I'm like, there is no such thing. You are not just anything. Their jobs, they do so much. We remind them again and again, you guys do so much. You have such a purpose. And you are helping people. That's exactly what you said. They're having to pay attention to this and this at the same time and have like four hands. I don't know how they do it. It's quite impressive.
Yeah, yeah, and then prepping the operatories the day before, and then if they have another in another room, they have to have that prepped, clean up and prep and clean up and prep. Oh my God.
Absolutely. No, I have a lot of respect for honestly all the positions. They all play such a big role.
Yeah, quite a team, quite a team. I mean, over these past few months that I've been doing this, I've learned so much about the dental home.
Hmm.
It's
Hmm.
mind-boggling. So I have a totally different perspective as to how to deal with dentists in the future.
Yeah. Yeah. Oh,
Before
yeah.
and after. I mean, I love who I'm dealing with now, but I'm just saying if I ever had to move,
Yes.
I know what to do, what kind of questions to ask. This is just fascinating information. So what are you finding that's most beneficial in the technical space that really helps you guys do what you have to do, whether it's software or a piece of equipment that you really, really think is taking you to the next level?
Yeah, I think probably there are two things. One is we moved to the cloud. We used to have kind of the clunky server-based software, and I know that works for some groups, but for us, having to replace the server, it was becoming difficult. Being able to having to remote in using an external software, from home to be able to see schedules, that was difficult. So being cloud-based has changed the game for us.
Okay.
And I think the second thing is just AI. I know that's really big everywhere, but in dentistry, it's exceptional. I'm just so amazed by all the things coming out every day. We use software to analyze our patient calls. How are the team members handling it? We can put in certain words that we want them to use, and it'll grade the call. AI on the X-rays, that's another big one. And I know they're talking about AI receptionists as well. So I don't know how that's going to go yet.
Mhm.
But I'm really excited about that because we don't see it as it's not to replace people, it's to enhance their abilities.
So are you more a people person, uh, providing the service to other people, or I mean, are you trying to, I mean, and I'm not saying like you mentioned earlier, not trying to cut anybody out, but
Yeah.
trying to figure out a way to make, your business better. And, you know,
That's exactly it. Yeah, I know there's a lot of talk now, right? There are big corporations out there, not in dental, that are cutting a lot of people because they're like, well, AI can do their job. We don't see it that way. I think we have some really great people. We're
Mhm.
seeing it as how do we help our people focus on the patient experience and not have to do those kind of nitty-gritty things that can take up time, kind of just tasks. How do they work on focusing on the patient?
Yeah, you want to definitely keep that human connection as much as possible, no question about it. Are we
100%.
finding ourselves as people in the dental industry not paying attention to close enough attention to the business aspects
Mhm.
of dentistry by and large? I'm not speaking
Yeah.
specifically to you, but I am speaking about the larger um, organization, or I guess industry, the larger
Yeah.
industry.
Mhm. Yeah, I think that that's probably true to some extent, right? There's been not as much focus on numbers. So sometimes when you come in and take over a practice, the team's kind of like, "What is this? We never did this stuff." And we explained to them, right? For us to be able to improve benefits, for us to be able to improve infrastructure really within the practices, like we have to look at numbers. We have to run it like a real business. But I completely agree with you. I think the traditional single doctor practice hasn't necessarily been that way. In general, there are practices I've come across that definitely have been more data driven, but
Mhm.
generally I agree they haven't been that way, and I'm happy to see that it's becoming more data driven rather than feelings driven.
What about supplies and things like that? Because what I understand is supplies definitely comes into the picture,
Yeah.
where it could be very expensive. And if supplies are sitting on the shelf, that means they're not being used. That's also meaning that those dollars could be used for something else, right? That will be moving.
Yes.
I mean, uh, how much of attention do you guys pay to something like that? I mean, is there some type of program that you all use to make sure that you're not buying too much?
Yeah, that's a great question. In the beginning, I'll be honest, in the beginning, we used a supply company that would give us kind of, if we bought a bulk amount, they would give us some free goods. So we started off doing that. And what we realized is exactly what you said. We
Mhm.
would open up closets and there would be piles of expired supplies. And that was probably adding up to tens of thousands of dollars,
Oh my
in a
God.
year. It was very expensive.
In a year, you said?
In a year, yeah, we probably had, when I say tens of thousands, I'm not saying like 50,000, but I would say at least 10 to 20,000 in a year that we would
That's a
realize
lot.
expired. That's a lot. It's a lot, exactly.
Yeah.
So we actually moved away from that, and we now work with a supply company that allows us to set a budget for each practice. And we approve their order. So we'll give the practices the budget. They'll put in the order, they'll submit it, and then we approve them. That way we have oversight as far as, what they're ordering. We have a formulary. And for the most part, we tell them 95% of your items, you have to stick to the formulary. If there's a doctor or hygienist that's extra productive and they want something special, we could talk about it and maybe slide that in there. But generally, we'll get better pricing if we use the same manufacturer as an example. And they only order for a month or so, and they have a month on standby. So that way we are not ending up with boxes of expired anesthetic.
Yeah, so you have a month on and a month off.
So we order every single month for
Okay.
the month, but we make sure that we have a month on standby as well, just
Oh,
in case
month on
in that
standby.
month we get
I
busy
missed
very
that.
quickly. Mhm.
Okay. All right. Yeah. Okay. Well, because like I'm thinking, yeah, $10,000, $20,000.
Lot.
That's easy, $200,000 in 10 years, on 4%. I'm like, very easy.
Huge.
It's like, so yeah, I totally get why you guys, okay, let's pivot. So when you look at something like that,
Mhm.
are there other areas within your practice that you kind of like making sure that you're not doing the same thing that you've done with anesthesia, for example?
Yeah, I mean, we watch we it's changed because we used to be in the practices all the time and we used to practice.
Yeah.
We were really kind of involved in every piece of it. Now we kind of look at it on a P&L, right? Is it within the appropriate margin? That's
Okay.
kind of what we're looking at. We set our own benchmarks. We looked at industry standards, and of course, we want to do better than that. So we set our
Right.
own benchmarks for everything.
Yes.
One of the examples is repairs, right? How much are we doing chair repairs or handpiece repairs? And if we see that a practice is getting more repairs done, then we're going back and saying, okay, is this a training issue, right? Because it doesn't make
Yeah.
sense otherwise. Or is the equipment failing? And that's why there are so many repairs being done.
Okay.
The second is managing staffing and their schedules. One of the things we would run into is back when we only had like one doctor in every practice, if a doctor was off for the day, we would find out that the whole team was sitting in the practice. So we were losing money on that because the manager decided the whole team's going to come in and get paid for the day. And we said, no, we're not bringing in revenue, so we can't afford to pay the whole team for the day. So we've created a process around that. And that's a really big one. As payroll is the biggest expense.
Yes.
So little things like that, I think paying more attention to those systems have really helped us.
Yeah, payroll and benefits can be very, very expensive.
Absolutely.
Extremely expensive. So you make sure that you have the payroll in place, making sure that you're doing what you need to do there, making sure that supplies are in place, um, and that you're not overspending there. Um, I know you said there was something else, but I know there are tons of things that you guys have to make sure that you're within the ballpark of your spend, and
Correct.
and you're being profitable. So you're finding most of this in your P&L statements, but are there areas that that you can play a closer look to than what the P&L is actually showing you? I mean, like, for instance, you mentioned you didn't really realize that you were spending as much as you were in anesthesia, I mean, in the anesthesiology, in medicine,
Mhm.
uh, that you were until, you didn't find that out by the PN through the P&L, did you?
So to be very frank, back then I don't think we paid as much attention to P&Ls.
Yeah.
So our supply costs, we weren't tracking them very well. Now we do. I'm sure that, if we went into the individual practices, we could probably shave off a 0.5% here and there. But for us, we're looking at, again, industry benchmarks and trying to better those. Back then, what we would do again with the bulk supplies is we didn't have a budget for every office. We'd have the bulk supplies and whatever they wanted, we'd give it to them. So that's kind of where we've really changed is I think with the P&Ls, we have a pretty good handle on what each practice is doing. And then
Okay.
comparing to the other practices, I think that's very helpful. And again, like I said, there are, I'm sure if we're within the practice, there are going to be little things we can shave off here and there. But the way we look at it is overall, is it performing? Is each practice performing as we expect it to?
Right. Okay. And are you guys a fee for service or PPO?
We're PPO.
Okay. So that's could be another issue, right?
Yes. Definitely.
lagging payments from the insurance companies. How do you
Absolutely.
guys deal with that?
Yeah, it's just managing the cash flow, right? I think that's a big problem. A lot of businesses, as you know, they run out of money not because they don't have a sound business plan or that they're not a good business, it's that their cash flow isn't there. So that the big piece to that is we have our eyes on insurance like a hawk. It's something on top of our practice leaders and our operations managers' mind at all times, and we're always looking at accounts receivable. Um, and you're absolutely right. I think one of the things is many insurance companies do kind of pay within a 30-day cycle, but we make sure that in our claims that our doctors and hygienists, they're putting in all the information needed. Even if the system doesn't prompt them to, we tell them you have to add X, Y, and Z, because if we wait on it, and the insurance will inevitably come back and say, we need this information, and they'll delay the payment by 30 more days. So we're very clear on that process. State of Illinois, Delta Dental, they take 18 months to pay. So yeah, so it's making sure that we don't have all our eggs in one basket as well.
Yeah,
It's not having all state of Illinois Delta Dental patients. That would kind of be
right,
catastrophic for us.
right. So, so have you guys considered maybe doing a little bit of both, or you're going to pretty much stick with the insurance piece?
Yeah, we're PPO and fee for service. So we do both. We have in-house membership plans as well.
Hmm. Hmm.
But yeah, I think, one of the big things that we tell our doctors as well is make sure you're treating the whole patient. Don't just treat what insurance covers. That's a great way. If you treat only what insurance covers, that's a great way to end up in a position where, number one, the patient's not taken care of and the condition is just worsening, which inevitably will cost the patient more time, pain, and money. And the second piece is, if you're only doing what insurance covers, you're not going to be able to stay ahead of insurance payments.
Hmm. So how do you keep your patients happy? What are some of the things that really resonate with you when you are looking at keeping them happy and
Yeah,
taking away the anxiety, if you will? I'm sorry about that.
yeah. I think it's all about, it starts with, we tell our team, it starts with the person answering the phone call. It
Mhm.
really does. When patients call, everyone thinks, well, it's up to the dentist to make sure that they're doing well, or it's up to the dentist to take care of the problem. That's not true. That anxiety starts when they call the dentist. A lot of people, as you know, are scared. So when they get that first phone call, when they make that call, the person answering the phone, we tell them always compassion, right? If a patient calls and says, I'm in so much pain, it's not, okay, when can you come in? It's, I'm so sorry to hear that. We're here to take care of you. So that's step one. The second step is when they come into the office. The person who greets them when they first walk in the office, make them feel comfortable. You yourself said, right, that there's a dental assistant that you're talking to who's not only assisting the doctor, but is also making sure the patient's not anxious. That's a big piece to it. And of course, doing good work, but we do tell our dentists it's you should absolutely do great clinical work. That's a standard for us. But patients don't care where the margin of your crown is. They care about how you made them feel. Did you make them feel valuable? Did you make them feel like a number? Did you make them feel like their needs were addressed? Was their chief complaint addressed?
Mhm.
And did they leave the office feeling good? Because dental care, we all know, it's not cheap. So did they feel good about the care that they received? And the biggest compliment to me is getting a patient who may or may not know that they have an issue. They come in, they spend thousands of dollars, and they leave with a smile on their face. I know I've done my job, even though they gave me thousands of dollars.
Excellent. Excellent. So now you get your patients happy, and you one of the things that you hold high in your process of doing things is a CE courses.
Yeah. So
And so go
yeah.
ahead. Go
No, I
ahead.
was going to say absolutely. Continuing education is very, very important to us. We tell our doctors that, so we provide about three continuing education courses a year within our group.
Mm,
But we do tell our doctors, look, at the end of the day, when you go to dental school, that is the beginning. That is just the beginning of your journey. Getting a degree is step one. After that, it's on you. You have to go. If you say, I want to be, the best dentist out there, I want to have all these skills, you can't rely on your company to do that all of that for you. It's got to come from you and you've got to go and seek them out. We're here to support you and help you figure out the best courses, but
mm,
you have to want that.
mhm. Do you ever see yourself going back to the chair?
I think at this point, most likely not.
Okay.
Because I've got to spend, I've realized my impact is very different now. I used to be able to impact the patient one-on-one.
Yeah.
And I did that for 14 years. My new impact is how do I impact teams? How do I impact our dentists, to live a better life? And we're on the Wealthy Dentist podcast, right? One of the ways I do that, we have a 401k and I got on a couple of L10s, which are EOS meetings, and talked to our practice leaders and some of our dental assistants. I was like, hey, do you know about our 401k? And some of them didn't even really know what a 401k was. They didn't know the power of compound interest. And I sat there with a compound interest calculator and I showed them, did you know, let's talk about what's reasonable to invest every month. And did you know that this is what you could have after 40 years of investing? And I think that's where my joy and my impact lies now is how do I help my teams get to that, I guess, making their lives better so that they in turn can also help make the patients' lives better.
Yeah, that's right. Definitely a trickling down kind of effect, isn't it?
Mhm,
Right?
absolutely.
If they're feeling good, they're happy, that's going to definitely um, s- I guess benefits it's going to benefit the whole the you can't hide anything from these patients. They're going to come in and they're going to see that right away, whether there's any kind of animosity, any anxiousness going on, any fidgeting, any frowns.
Oh, 100%. 100%. People pick up on body language, right?
Yeah, 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 yeah.
Yeah.
So what are you doing that you're finding the most interesting right now? I mean, if you had a couple things that you could think about that you can do, like, I mean, like right away, you just want to do this because you love it. What would that be, or what would those two things be?
Yeah, I think we were talking about process and becoming kind of operationally savvy. And that's one of the things I see missing in the dental industry. That's something I'm actually working on with Aereo is how do we create our own infrastructure
Mhm.
uh, to kind of make it more intuitive
Mhm.
and make it much easier. I'm not going to give too much away, but
Yeah.
with that, how do we expand that into the rest of the dental industry? So that's
Mm.
something I'm really excited about working on right now, rather than depending on written or, video processes. How do we make it much, much easier to take what's in our brain and put it out there?
Yeah. Yeah. So it's accessible. Once you know you're successful with it, you're willing and really have in mind to share this with the a larger community, the broader community.
Absolutely.
That is
I
wonderful. That's visionary.
I appreciate that.
Anything else?
I think that's the main thing right now. The second thing, of course, on my end is just getting the MBA so I can learn how to better serve the business and our people as a result.
Anything particular? Because I did want to get to that MBA. Anything in particular that you think an MBA is going to help you most in the process of handling your business?
Yeah, one of the things I'm very curious about is incentive structures and
Oh.
financing, So I think I don't know if you've heard the story about the British, I don't know if it's a true story, but the British would have they would have a snake problem when they were in India. They had a snake problem. So what they did is they told the Indians, hey, for every snake that you capture with its head cut off, we will go ahead and give you a kind of an incentive for that. So what ended up happening is the Indians were like, oh, I get money for every snake head that I bring to them. So they started breeding snakes and then they started letting them go. And then they started, they would cut their head off and give it to
Bring
them.
it.
And the British became aware of this and they said, you know what, we're not going to pay anymore for this. So what did the Indians do? They decided, okay, well, these snakes are of no use to me anymore. So they just let them all out. And then the snake problem became
Ooh, it's a
worse.
problem. Oh my God.
So I
Oh,
think about
man.
that all the time. One of the biggest things is how do we create that structure, incentive structure that is not creating snakes out in the wild.
Don't want no extra snakes around.
Yeah, we don't want any, we have to be careful what we're incentivizing, right?
Yeah.
And also talking to other brilliant minds within, the one of the big parts that people do MBAs, as you know, is networking and finding other brilliant people. So in dentistry, they don't teach us a whole lot about business and dental school. I don't think I learned anything about business and dental school.
Mhm.
And because of that, I know you've heard that people say dentists are very poor business people. I have my own thoughts about that, but I think a big reason, of course, is that they're not getting that training. So how do I, as a clinician, educate myself so I can run this business in the way a business should be run while also holding true to my clinician background?
Hmm. Yeah. Wow. Yeah, that makes sense. So I'm going to just make just a brief pivot because I remember you saying one of the things that really like you were really uh, happy in committing yourself to was working with women
Hmm.
and giving them the opportunities. I guess that you probably saw it would be better for you had you had it. You
Yeah.
know? And so, what would those things be? What is it that you focus on the most in helping your uh, female clinicians?
Questions. Yeah,
Mhm.
that's a great question. When I came out of dental school, obviously, it was 2011. So not terrible at that time, but there were still things that happened that made me question the industry. The reality is that, women being in leadership positions in dentistry, it's still relatively new to the industry in comparison to how long it's been around. And female clinicians, though we make up 50% nowadays, in the past we didn't. So I remember one of the jobs that I worked at as a dentist, there was a rep that came in for some product, and I worked in an office with three male dentists and me. And he was going to do a lunch and learn. So we walked into the break room, and it's the three guys that walked in first. And this rep goes, "Hi, doctor. Hi, doctor. Hi, doctor." And he looks at me and he goes, "So you must be the hygienist." Now, not that there's anything wrong with the hygienist, absolutely not. As I said earlier, I love
Typical,
our
right?
hygienist,
Yeah.
but it was the assumption. The assumption bothered me. It's the not asking, right? In the same way that he assumed that the members that were men there were dentists and not hygienists. We've had male hygienists. That's a thing as
Yeah.
well.
Yeah. I met that.
Um,
I met some.
yeah. Yeah. So for me, it was looking at that and saying, okay, part of it is maybe it's me. Maybe I just didn't present like a doctor. Maybe I walked in underconfident. I don't know. So one of the things I've really focused on is our dentists, our female dentists, especially our new grads. They come in my experience, many of them will come in more timid and more afraid to kind of voice themselves in terms of how do they communicate with the patient, with their clinical skills. Are they confident? So I kind of work with them one-on-one to tell them, you being a woman does not mean anything. A lot of people, in fact, prefer female dentists. So lean into that. Lean into your skills. You went to dental school, you got the same training as everybody else. And that's kind of just being a mentor to them in that sense.
Yeah, definitely. They definitely need it. And yes, uh, unfortunately, those kinds of things happen, right, with the reps when they come in and assume one thing and it's totally different than what they thought. This has been really, really wonderful and educating for me. I really enjoyed you speaking and coming in, or taking the time, I should say, coming in and speaking to the wealthy dentist community about the things that you do as a leader, as a founder of a seven practice office. Um, and the sky is the limit. I don't, you might have taken the total out of your head, but man, I see you guys flying and doing a whole lot of things. They don't call you Ariel for nothing.
Thank you so much, Ward. This is amazing. And as I said, I was looking really forward to this podcast, and this was really, really fun.
Awesome, awesome. Well, thank you for coming. And hopefully we'll bring you back and see what you guys are doing these days. That would be
I
great.
appreciate that. Yes, and
Okay.
hopefully we'll get to meet in person soon.
Oh yeah, yeah. Well, you know what? Hopefully that will be something that will happen, and we'll definitely look forward to having that day come real soon, hopefully.
Awesome. Great. Thank you again for having me.
The Wealthy Dentist podcast is built on connections, opportunities, and meaningful conversations that help jumpstart careers and boost the ROI on your business. Is there a topic you're passionate about or someone in the dental community who should share their story with us? We want to hear from you. Email your suggestions to the Wealthy Dentist Podcast at gmail.com, and let's create content that informs, inspires, and uplifts the dental world. Your ideas could spark our next big conversation. Let's make it happen. I'm Ward Powell, your host at the Wealthy Dentist Podcast, thanking you for being a part of our journey.